Hello, everyone, and welcome to another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. Ben Franklin said, "Early to bed, early to rise makes a man healthy, wealthy, and wise." The updated version is, "Early to bed, early to rise, work like hell and advertise." You know, a good night's sleep is an essential part of a healthier lifestyle. However, many people today have a difficult time getting to sleep and sleeping restfully throughout the night. With us today is an expert in sleep and sleep disorders, East Brunswick's Dr. Andrew Freedman. Trained in practicing internal medicine and a specialist in the field of pulmonary critical care and sleep medicine, he strives to improve the overall quality of life for patients suffering from chronic diseases through personalized treatment plans. Andrew, welcome to the Wellness Spotlight.
Thank you.
My long-lost cousin with the same last name.
That's right. It's good to see you.
Actually, this isn't nepotism. We are not related, even though you spell your last name correctly.
That is correct.
Just like mine.
Yes.
So, Andrew, you've been in town a long time, haven't you?
Yes.
How many years?
I've been in East Brunswick since 1987. And actually, I've known you that whole time, too. It's good to be back and see you again after all these years.
Yeah, thanks. Tell us a little bit about your background and experience.
Well, I'm a physician. I specialize in pulmonary critical care and sleep medicine. I'm board certified in sleep medicine, which is why we're talking about this today. Went to medical school in New Jersey Medical School in Newark, did residency there, part of my pulmonary training in Philadelphia, and then part of it here in New Brunswick. And then I just liked it here, so I stayed here.
What made you get involved in sleep medicine?
That's very interesting. Back then, sleep medicine was in its infancy when I was in my training, because many people ask, why am I seeing a pulmonary doctor, a lung doctor, about a sleep problem? The truth is that with the recognition of sleep apnea as such a major illness, the pulmonary doctors treating a respiratory disorder basically flowed into becoming sleep doctors. And with the growth of the specialty and the board certification, it turns out that many doctors who specialize in sleep medicine are pulmonary doctors. However, I think one of the interesting things to bring out, since we're discussing wellness issues today, is that sleep disorders are not just sleep apnea. There are other things we have to think about.
So, do Americans get the right amount of sleep these days?
Generally speaking, most Americans do not. Actually, most Americans are sleep deprived. That's a recognized thing for many years now.
Why is that?
Part of it is, you might say, lifestyle, social things. For instance, there's a lot of social pressure to extend the day and stay up later and later, a big problem we run into with young people, teenagers, college age, as well as trying to be up early to do all the commuting to go to the various jobs. So as a result, people do not really sleep as much as they used to, let's say 100 years ago, and people walk around in a chronically sleep-deprived state.
You know, our viewers who are old enough to remember Johnny Carson, Johnny Carson used to kid that his program was, a glorified nightlight for a lot of people.
True.
Is it because people have televisions in the bedroom that it sabotages the ability to be able to have a good night's sleep?
Well, there are many reasons people extend their days, so to speak. Again, part of it is they stay up late to work. Part of it is television. They are on the computer. And that gets to some interesting things about the nature of sleep. For instance, people have a regular schedule for sleep, a so-called circadian rhythm. That's the terminology for the 24-hour cycle of wake-sleep. And the fact is that the body is trained to, or I should say the brain responds to light. Light promotes wakefulness, darkness promotes sleep. And one would realize that back in a more primitive time, we knew to be awake during the day and sleep at night. With the development of electric lights that allowed us to extend our day, as well as, again, like we discussed before, social pressures to extend our day, people just stay up longer. The more light they're exposed to in the evening, the more likely they are to promote wakefulness in the brain. And that's mediated by a very common chemical people often know about called melatonin, which some people take as medication, which we can discuss further as we go along.
How does a person know whether or not they're getting enough sleep?
Well, the truth is, a lot of people realize that they're sleeping. Though, interestingly, A good example I often give to my patients, when an adult is sleepy, they just say, I want to go to sleep. When a child is sleepy, they go crazy. Anybody who has children knows that, which is an important thing to keep in mind in the world of pediatric sleep apnea. Touching on that briefly, when a child, let's say, is labeled as hyperactive, I'm not saying for all hyperactives, but let's say hyperactive or misbehaving in school or not learning. Could be that the poor little kid is just sleep deprived and they are walking around in a chronically sleep deprived state.
That's interesting because a lot of people would probably think that their parents are giving them too much sugar.
That's one of many things, and one of the problems in medicine and wellness, as you well know, is you can't do a one-size-fits-all for everything. But you do have to consider multiple things. And very often in a child who is acting in these certain ways like we talked about, acting a little crazy, hyperactive, can't pay attention at school, those are actually the subtle signs of a sleep-deprived child. They have trouble, and this also goes for adults too. They have trouble with memory, they have trouble with learning, they have behavior problems, can lead to depressive behavior, anxiety behavior. Interestingly, and this gets into some of the issues about sleep apnea we can touch on later, is that in children, they might snore, they might have bizarre sleeping patterns of waking up a lot. Those are the things.
And, you know, why is a good night's sleep so important for health?
There are certain physiologic processes that take place during sleep. In a nice simplified way of looking at it, sleep exists in a cycle. And during the night, you go through a few cycles in which you have a background of what's called light sleep. Then you have something called deep sleep or slow wave sleep. During that period of time, which predominates in the early part of the night, there is, you might say, and again, people who want to get technical might fault me for my oversimplification, but I think it's legitimate to say there's body restorative processes. Not much brain activity, but a lot of biochemical and repair activities. In the latter part of the night, there's something called REM sleep, rapid eye movement. Many people have heard of that. That's the sleep where you dream. A lot of brain activity, the eyes are flitting, but there's no muscle activity. And that has to do with functions of consolidation of memory. And therefore, you need these biochemical processes during the night so you can function during the day. So sleep is actually a very active time in terms of body processes, and you really do need sleep.
What stage of sleep is going on when people are talking in their sleep?
People who talk in their sleep are actually in what you might call light sleep. Sleep talking, interestingly, is actually a phenomenon usually in the early part of the night, light sleep. It makes for a lot of drama, not really very relevant in terms of any major sleep disorders.
Does that also go for sleepwalking as well? Sleepwalking,
those are under a category known as parasomnias, commonly seen more in kids, and that's a phenomenon usually of a type of non-REM sleep called deep sleep. Children might have sleepwalking, or they might wake up with things called sleep terrors, in which they're screaming and they're not consolable, very dramatic, very scary for the parents. Interestingly, a totally benign condition.
How does our need for sleep change over our lifetime?
There is a natural maturation of the sleep process, the sleep system. Children need a certain amount. You'll find with children they have a lot of slow wave sleep. As we get older, well, let's just put it this way. This is an important thing, very relevant, for instance, in teenagers and college students. There's a maturation that hits teenagers, sometimes extends into the college age, and it actually creates a lot of social pressures. These young people tend to want to go to sleep later and wake up later.
They're like vampires.
Right, and it actually has a terminology. It's called phase delay syndrome, in which case there's a natural delaying of sleep. And this gets back to some of that circadian rhythm things we talked about. They stay up later, they're exposed to more light. They want to go to sleep at 1 o'clock in the morning, 2 o'clock in the morning, wake up at noon. And the trouble is, the more they entrain and get their brain used to that, they can't get back into it. The best way to describe it is that they may be physically here in New Jersey, but their mind is really in California. So when it's 11 o'clock here and they need to be going to sleep, in their brain, in terms of their rhythm, they're really only, let's say, 7 or 8 o'clock. And as a result, they get up later. It leads to a lot of social problems because they have to get up in the morning and go to school, go to classes. Again, it's more of a, I guess you might say, a social problem, but it is something that can be treated, though it takes a lot of work. As I often joke with a fair number of patients who have this problem in college, they can't sleep, they need sleeping pills, what's wrong with me? I said, I can guarantee you, the minute you graduate and you have to show up for a job, you're going to get cured real fast.
How long does it take for somebody to get back into the swing of things?
That's very interesting. It varies for people, but it can take many weeks to sometimes a couple of months. And there's a number of techniques that we're supposed to go over with the patient. But really, like a lot of these things, it depends on insight, motivation, and how hard you want to work with it. Sometimes we have to use a little pharmacologic therapy. One of the important things about sleep medicine, which I think is a very important aspect to discuss about the wellness of sleep, is the need to try to avoid medication. Regrettably, many Americans say, I can't sleep, I need a sleeping pill. And the first thing is they need pills to go to sleep and then pills to wake up, and they get into a very bad cycle.
Well, it seems that whenever you turn on the television, just about every other commercial is for a medication that's going to help you sleep better.
That's true, and one of the problems is that these medicines have a fair number of side effects, and that's why it's very important when the patient says, I can't sleep or my sleep is terrible, you really have to very systematically take apart what they're saying, because there's several approaches to it. Because the knee-jerk thing is, I can't sleep, oh, here's one of the, I don't want to mention specific names, here's a particular sleeping pill.
Right.
And then very often when they come to see me, you find they're getting a lot of medication, sometimes beyond the FDA recommended dosing. They have a lot of, depending on the dose, residual effects into the day. Some of these medicines are known to cause amnesia, so that during the day they have blank spots and they don't know what they're doing. They have memory lapses. And then sometimes there's some sleep medicines that actually need to be used for certain things. Like
so they're being prescribed off-label?
Well, not so much off-label, they're just not being prescribed correctly. Some sleep medicines really affect the so-called circadian rhythm. We're going to use that term several times, so people are going to be experts on this idea of a 24-hour cycle, because the truth is, over and over again, if you want to have healthy sleep, you have to think in terms of that so-called 24-hour cycle. But there are medicines that actually affect that schedule, and then medicines that just affect level of consciousness and sleepiness.
Disruption of the sleep cycle, aside from college students, must be especially hard on people who do shift work, like police officers, firefighters, people who are working in retail, especially during the holiday season, things like that.
Shift work is the great enemy of sleep hygiene. But we accept the fact that we have our jobs and we need to do this. But it is very important for sleep health to maintain a regular schedule. And as a result, shift work can be a problem. Sometimes it's actually better either to do all nights or all evenings, let's say if they can't do days, than to constantly be rotating. And actually, for some people, it's actually even dangerous, because their body may be in a part of the cycle when they really want to be asleep, but they have to be at maximal alertness. And considering some jobs, that can be very dangerous, both for them in terms of their exposure to dangerous situations, or others if, let's say, they're driving and doing something that other people could be hurt.
So in addition to staying up too late watching TV or socializing, what are some of the other things that you feel rob us from our ability to be able to have a good night's sleep?
Well, I think one of the biggest things I wanted to touch on is, again, the terminology, I can't sleep. And people will say, I can't sleep, my sleep is terrible. And you really have to differentiate when talking to them. Is it a problem going to sleep or a problem staying asleep? Very often a problem going to sleep can be related to, I like to differentiate between what I call internal and external things. Internal things are medical problems that they can't sleep. And some of these are also the same internal problems that cause them to wake up all night. And you have to go into a detailed history.
What would some of the most common things be?
Medication. Without a doubt, some of the biggest causes of disruption of sleep are the very medicines, or sometimes foods. For instance, having a lot of caffeine before you go to sleep.
Before bed.
It may sound like common sense, but people do it. It also causes people to wake up a lot at night. There are certain medications that cause sleepiness, certain medications, actually some antibiotics, you have to look at the warnings, actually cause people to have trouble falling asleep. For instance, medical conditions also cause people to have trouble falling asleep. People with diabetic neuropathy have incredible, they might have pain. Right, and they have a lot of leg movement problems. People with heart failure may have shortness of breath the minute they lay down. Gastroesophageal reflux is a terrible cause of
breathing disorders.
Right, burning, chest pain. They have aspiration episodes, and then people with urinary issues having to get up at night to urinate. The frequent awakening for nocturia. Nocturia is a term for waking up to have to go to the bathroom. Those are things that cause disruptions of sleep. And then people have trouble breathing at night, either breakthrough asthma or wheezing during their sleep, and finally sleep apnea. And I wanted to bring out sleep apnea. If you notice, I said at the very end. One of my points I always like to bring out is people hear a lot now about sleep studies. And though I'm involved with doing sleep studies, we do a lot of sleep studies. One of the important things is that sometimes people run to get a sleep study, or their doctor prescribes a sleep study. They then get some data, and the doctor doesn't quite know what to do with it. And I have to be honest, sometimes my response is, don't do the test if you don't know what you're going to do with the information if it's positive. And the working up sleep apnea and doing sleep studies comes only after going into a very detailed history about all the other things going on with the patient.
So, in addition to some of the things that you've also discussed, the medical causes of loss of sleep, what are some other causes?
That's actually a very good question, because, as again, I break it into the internal and the external. Internal are internal things, internal medicine things happening to your body. Then there are external things. There's anxiety, there's depression, there is terminology called psychophysiologic insomnia. That's the terminology for someone who lives at such a level of stress and intensity, they can't bring themselves down enough to go to sleep. And that's where I like to say they go from an external thing to an internal problem. But then again, another external thing, again, are schedules, staying up late at night, causing a change in clock in which you've taken an external cue and it's turned into an internal problem. Finally, one of the external things has to do with a terminology that we put under the category of sleep hygiene. Again, common sense things, but still, these are things that if you don't think about, people don't realize. For instance, the room has to be a certain temperature. It has to be dark. You have to control the noise. And then finally...
what's the best temperature for a person to sleep in?
Everybody has their own individual thing. There are some people who need the room at 80 degrees, usually patients who are older, and then there are some people who need the room freezing. You have to pick your thing, but whatever it is, you still have to just find it and stay with it and stick with it. Now, of course, if people are, two people are sleeping in the same bed, and one likes the room hot and one likes it cold, then you have to work out some compromise, and that's for them to work out.
If a person snores, Andrew, does it mean they have sleep apnea?
In most cases, yes. My best description about sleep apnea is if you snore, you don't have a problem. It's the spouse or spouse equivalence problem. They have to listen to it.
Right.
But again, the question is, how does it become your problem? Snoring, I think it's an important point to actually explain what is snoring. Snoring is the sound of breathing in through a narrow airway. Snoring is the structures in the back of the throat, the palate, vibrating, and for want of a better expression, flapping in the breeze. Everyone's familiar with the palate. Everyone goes to the mirror and looks in the back of their throat. They see at the very back there's a little arch, and the little thing hanging down is called the uvula. So everyone's going to be an expert on the uvula.
Looks like a little punching bag.
Right. The uvula, and that's the soft palate. And what happens as you're breathing in, that sound is the sound of the structures in the back of the throat vibrating because they become narrow. So the real illness is not really snoring, it's breathing in through a narrow airway, or reducing airflow as you're breathing in. Breathing in is called inspiration, reducing inspiratory airflow. And there are basically three consequences that I like to bring out to a patient when I'm explaining it to them. Number one, if you reduce inspiratory airflow, that can lower your oxygen, which is obviously not good. Number two, because your brain is smart enough to know you're in trouble, you wake up. You're not breathing. And what happens is that this waking up all night long causes you to be sleep deprived the next day. The third thing, again, because your brain is smart enough to know you're in trouble, you have an outpouring of stress hormones, adrenaline and a few other hormones. This is not something we pick up during a sleep study, but this outpouring of stress hormones causes over time, every night, to raise your blood sugar, raise your blood pressure, raise your heart rate. Hence, that's how somebody goes from just being noisy and bothering everybody else in the house to somebody with a medical problem that needs to be looked at. So therefore, the fact that you snore doesn't mean you have sleep apnea. But the fact that you snore implies you could, and you could be exposed to all these problems, and that's somebody that needs to have it investigated. Sometimes people wake themselves up. Again, this gets back to that thing you asked about the sleeping pills. People say, I'm not sleeping well, I need a sleeping pill. Very important to keep in mind. If you take a sleeping pill and you have this condition and it relaxes your airway more, it will make the problem worse, not better. So that's why a person shouldn't just randomly take sleeping pills.
The biggest challenge is people have busy schedules. So what do you say to your patients who say they have busy schedules and they're having a tough time getting enough sleep? How do they develop strategies to be able to make more time?
Well, it's not a matter of making more time. Again, it's a matter of, in a systematic way, going over what is the problem that you have. You can't make more time. The question is what you're doing with the time that you have. Again, for instance, when the person says, I can't fall asleep, we take apart the details of why can't you fall asleep, and we go through the sleep hygiene things, and we see, are there anxiety issues or are there physical issues? If a person says, I have to get up at 3 o'clock in the morning because I have the commute all the way into Long Island every day, well, I can't fix that, but we have to make certain that they have to adjust their schedule to fall asleep and their sleep is not disrupted. There's a terminology, it's interesting, called sleep debt. Sometimes people make it up on the weekends. The body needs a certain amount of sleep, and you are going to wind up paying back that sleep one way or the other. So sometimes people do have to make up the sleep at other times.
And that's where naps come from.
Right. Of course, people have to be careful about their naps. Some people might nap during the day. That's an interesting thing. There is a natural tendency in the 24-hour cycle to have the majority of your sleep at night, wakefulness in the morning, and then sometime after lunch. There's a reason why people get sleepy after lunch. It's only natural. There's a sleepiness in the afternoon, and then there's another wakefulness burst. Interestingly, that's why sometimes in the afternoon there's a higher incidence of motor vehicle accidents because of sleepiness while they're driving.
I see. So what strategies do you give to your patients on being able to get a better night's sleep that don't involve drugs?
Again, we start with sleep hygiene. We start with the proper environment. We also have to have them make a conscious effort to look at what they do in their schedule, work around it, address medical conditions, go through their medications and make certain they're not taking things that are harmful to their regular sleep pattern.
Do you recommend exercise or eating certain foods? You know, we hear, especially on Thanksgiving, you know, you eat turkey and then the next thing you know, everybody's on the couch snoring.
Right. Well, large meals will tend to make you sleepy. That's a generally accepted fact. In terms of diet, some people find very high carbohydrate diets can do that. In terms of eating, that gets into the whole concept of nutrition. I think people sometimes, as a general rule, sit down and eat meals that are basically too large. Just in terms of general health, and this gets into something that we're not even discussing today, even diabetes and some other metabolic issues, people should have a strategy of small, frequent feedings as opposed to big, large meals having to do with hormones that are released during this time. As for exercise, exercise of course is important. Sometimes people say, well, should I exercise before I go to sleep or do I exercise in the morning? The general thing that has always been taught in the world of sleep medicine is you exercise in the morning, you don't exercise before you sleep because exercise before you sleep pumps you up.
It's going to ramp everything up.
However, you will find a subpopulation of patients who find that exercise helps them to go to sleep. For instance, exercise raises the body temperature, and the cooling as you come down from exercise actually may promote sleep onset. So, as we said in the very beginning, a one-size-fits-all just doesn't seem to work. You have to individualize, and you have to listen to the patient, hear their story. You have to individualize what's going on with them in order to know exactly what they need. And some people really should do their exercise later in the day. The other problem, too, is that everyone has their schedule. As you said just before, they're busy, they have so many hours in a day. If the exercise fits in the evening, I got to work around an evening exercise schedule. But the thing is that you still have to, exercise is important in terms of general health.
How far away from bedtime should people eat?
That's a tough question for the simple reason, again, there's no one right answer for everybody. Certainly, it's generally accepted in a number of medical conditions, we're often told not to eat within 2 hours of going to bed, having to do simply with the problem of gastroesophageal reflux. One of the biggest problems we run into in sleep medicine is nocturnal reflux, probably more than I think is even taught or is even published.
So that's where somebody's eating a meal and then they lie down.
And the food just gurgles right up.
You're tasting it again.
Right. And there are a lot of problems that happen with gastroesophageal reflux. The most obvious thing comes all the way up and you aspirate, and we see many cases in pulmonary medicine of aspiration pneumonia. But what happens is when you let's take it a step back. The normal physiology is that during sleep you don't make saliva, otherwise you drown. So that what happens is when the stomach is a very acid environment, the esophagus, your swallowing tube, is a very alkaline environment. What's an esophagus to do when all the acid hits it? There's an outpouring of saliva and secretions. In order for that to occur, your brain has to wake up. You may not recall waking up, but you can have a sufficient amount of wakefulness to generate this, and therefore the patient has, as we had discussed before, a lot of nocturnal awakenings, so the next day they're sleep deprived. This gets back to something as simple as gastroesophageal reflux being a cause of daytime sleepiness.
In about 10 seconds or less, what final thoughts do you have for people today on rest and wellness?
My final thought is pay close attention to sleep hygiene, have an open mind, and openly admit if something is not working, you really have to take it apart systematically and make it work.
Dr. Andrew Freedman, Andrew, thank you again for being a guest on the Wellness Spotlight. I really appreciated the lively discussion. I don't think anybody's going to fall asleep during your presentation, and we really appreciate you sharing your expertise with our viewers.
Thanks a lot. It's been very good to be here. It's good to see you, too.
Thank you. This concludes another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. I'm Dr. Ken Freedman, here today with Dr. Andrew Freedman, reminding you that wellness works when you work it.